2024. Yo soy Cristian Lina, estudiante del tercer año del programa de ubicación avanzada de la Escuela de Medicina Dental de la Universidad de Puerto Rico. Esta mañana me complace presentar al doctor Bernard Fialkov. El doctor Bernard was class valedictorian of his SUNY Stony Brook Dental School class in 1980. Other awards include the Alpha Omega or OQU Academic Award and the Pierre Fechard Award, International College of Dentists Fellowship. He received a postgraduate certificate in periodontal and dental implant from the Memphis VA Hospital, University of Tennessee Dental School. His private practice in Bayside, New York is limited to dental implant, laser, and periodontics since 1982. Dr. Fialkov is a founder of the Fialkov Dental Study Club Implant Center Training Program. The Dr. Fialkov is the president, founding sponsor of the Foundation for Drugs-Free World American Chapter, a drug education speaker at 6 United Nations event in NYSDA, chemical dependency member, an International Freedom Medal winner for drugs education in 2016, and he ran the opening NASDAQ Bell for Drug-Free World American Chapter in September 15, 2017. He's also the founder and producer of the TV show Time for the Truth. Démosle un aplauso al doctor Bernard Fialkov.
So, it's a pleasure to be with you here today. I apologize before empecé a hablar en español porque nací en Cuba. I started to speak in Spanish because I was born in Havana, Cuba. But I see we have a mixed audience, so I'm going to speak in English, and so that we are understood. The program is being taped live. The reason is that this drug problem is hurting and destroying so many kids, youth across the world. And obviously as dentists, not only do we treat older patients, adult patients, but younger patients and youth. And so it's very important that we know exactly where we are with this problem because there's a tremendous amount of misinformation. And since we're doctors, we have to go on scientific truth. What I want you to know is that what I'm going to present to you today is not my philosophy from New York or some entity. This is all going to be from the NIH, the CDC, New England Journal of Medicine, Journal of American Medical Association, John Hopkins. This is all scientifically referenced what I'm showing you. And I'll be more than happy at the end, if you have any questions, feel free to ask me. I want to first, when we start, is to acknowledge the organizers of the Puerto Rican Dental Congress, la Organización de Cirujanos Dentistas de Puerto Rico. That always happens to me because my father was a Cuban doctor, and so when I start doing that, it really hits me, and I apologize if some emotions turn on. So, this is what you see at the bottom is why we're here. And that's why I put that slide at the beginning. That was the Dominican parade down 6th Avenue in New York City. And I said to the father, let's bring your son out here and put on this shirt on him about a drug-free world. And he did, made a great photo. And that's really why we're here. And let's see here. Here we go. And so we're here to get the scientific truth of vaping, marijuana, and CBD. And whether or not these are actually gateways to the opioids. Because as a profession, and as all the health professions, we're restricting our prescribing. So we should be seeing a decrease in opioid use because we are not prescribing. And you'll see some very interesting things I'm going to show you that will make you alert as to why we have to leave the four walls of our office. I want to actually tout my friend, Dr. Marcos Garay, president of the Honduran Dental Association, who says we have to leave the four walls of our office and help our community. We're doctors, and if we're going to save their teeth, first we have to save their bodies so that their teeth can come walking into the office. And he's a very strong advocate for this. Also, Dr. Laurel Madrano, who is one of the directors of the Great New York Dental Meeting. Dr. Chad Gahani, former ADA president. Dr. Cesar Sabates, my friend, a fellow Cuban, former ADA president, and many, many other very important dental professionals. Gordon Christensen spoke with me at the Greater New York Dental Meeting. He was very upset about what's going on with drugs. He also feels, as dentists, we need to move forward. So let's go on. We have a lot to cover. And so I wanted to, as I said to you, to recognize the Puerto Rican Dental Association for putting on this great event. There you see the president-elect. I spoke to Yvette the other day. There you see Dr. Angel Robles. The guy next to him, very important guy, Rafi, who has organized the convention, another Cuban guy. So I feel very comfortable here surrounded by my Cubans. Below, we have a doctor from New York with a very interesting innovation, another doctor from New York. And so I want to thank and acknowledge the Puerto Rican Dental Society. Before I go on any further, it's always said that behind any man who gets anywhere in life, or he keeps his head on straight, there's got to be a woman. And even though she hates for me to ever bring her in front of the limelight, she's very private. That's my wife, Maria. She's Venezuelan. She was actually director of the Gallery of Art for Restoration in Caracas. And so she helps me a lot with going around the world and supports me. And as I see a lot of women in the audience, so when your husband's not around, your boyfriend, it can be difficult. So I really have her support. I'm a very lucky guy. So let's go on now. Why are we here as dentists? I mean, we're dentists. We do teeth. Okay, we do gums. Okay, we do dental fixtures. But we're dentists. So why are we going to bother to talk about this? Well, we're also fathers, mothers, aunts, uncles, sisters, brothers. And last year in the United States alone, actually in 2021, we lost 107,000 Americans to drugs. Now, I want to give you a comparison. 10 years, Vietnam War. Who wants to tell me how many Americans died? 55,000. You get A+. 10 years. Now, what happens with 55,000 if you double it? You get what we got in 1 year with drugs. But I don't see anybody protesting on the streets like they did for Vietnam. That's 1 year versus 10, and we doubled. Why aren't they protesting? Is it possible that the drugs are already having an effect on the society, and they've already been dumbed down and put to sleep? I see you're quiet. I'm going to elicit your reactions, and when I speak, I really want to interact with you. I don't feel I'm any better or different than you are. My philosophy is that unless we work together, we're all going to not have staff in our offices because they'll be high on drugs. When people are high on drugs, are they producing? No. They show up to your job on time? No. They seem really wonderful, and the next day you go, what happened to that wonderful person I met yesterday? Now you have the answer to what's going on. And if you have any nephews or nieces or have friends who have little kids, we're responsible for their environment. It's very quiet again. I know I got to you. That's what I want to do. I want to get to you. I'd like you all to go out of here invigorated that you're going to do something and that you're going to, at least in your office, educate these people on vaping, drugs, and I will tell you more about it. So in 2022, you say, well, it's getting better now. It's getting better because we're legalizing. It went up to 109,000. So now as dentists, we know that if we're doing something and it's not getting better, do we continue to do the same process? That's a question. Anybody can answer. No, we don't, because we base it on science. So let's go on. Vaping has become such a dilemma that the FDA, the CDC said, what is going on? How are we losing youth to vaping? All they're doing is vaping a flavoring. How can they be dying? But they found this happening across the country. We're not talking about somebody 70, 80, 60. We're talking about teenagers. We're talking them ending up in the ICU of hospitals across the country. And so you would think if that was happening, and we saw the drugs were increasingly causing death, which is a health crisis, and it was doubling the rate of a Vietnam War, not in 10 years, but in 1 year, that means actually if we doubled 2 by 10, that means 20 times. That means that we're losing 20 times the amount of people without war from drugs that we did in a war that was protested worldwide as an atrocity. And you say, well, Dr. Fialkov, this is dentistry. Yes, this is dentistry, one of the last professions that's standing for patient rights, that wants to do the right thing regardless of the coverage, that works difficult. You guys are amazing out there. This video is going out to the world, so I'll say something to the world. Your dentists are wonderful people because we try really hard. We really care as dentists as a profession. And so you would think in our offices, if we do the wrong procedure, we change. We complain to the company. We tell the researcher, you know, this is not working. Let's do a different bone graft. Let's do a different membrane. I'm a surgeon, I'm sorry. Let's put a different implant system. I don't want any more peri-implantitis. For those of you who are lay people, that means your implant's dying, falling out. So what happens is you would think that we would stop what we were doing, but look at what's been happening in Colorado. They legalized psychedelic drugs. That was a movie, Cheech and Chong, when I was in high school, you know. Hey, oh yeah. But that was then, I guess we had some rationality. Now what we do is we legalize it. That's what Colorado did. Why did they legalize it? Because this man, Matthews, an advocate in Colorado, said, you know, we have very poor mental health in Colorado, so we need a solution. I guess in dentistry, I guess if we saw that people were losing their teeth, I guess I would come out and say, well, we need to take more teeth out. And because, you know, we're losing teeth, so we're going to take more teeth out, you know. I know it seems ludicrous, but some of these things I see are ludicrous, but yet very little is being said. And you would think, well, that's only Colorado. That's out in the middle of nowhere. Yeah, I mean, that's good skiing, but what else do you have in Colorado except the mountains, you know? But look what they did in California. They passed the same bill. They legalized psychedelic drugs and mushrooms and LSD. Unbelievable. And a senator there said that was occurring. Why? Because he said there was a failed war on drugs. But can I ask you a question? And if your patients came in and you never educated them how to brush and floss, would they know how to prevent caries? Anybody could answer. No. Would they prevent periodontal disease if they weren't flossing? No. Would we just have them go on eating sugar? No. Because as professionals, we would do something that was efficacious. Yet, here we are losing people to drugs, and what we're doing is we're increasing the drugs. And what's missing? Education. Where is the education? What failed war on anything? Why is dentistry so wonderful? Because we've almost put ourselves out of existence. When I was in dental school, they had this enzyme, sialin. It was going to eliminate caries. And I said, well, why did I go to dental school? But it didn't really happen. And there was enough left to treat. And we still have so much to treat. And dentistry is advanced. So now we have cosmetics and Invisalign and veneers and unbelievable what we've advanced. But back then, there was going to be no dentistry. Why? Because we educated. We did things that were efficacious. We're good people, which is why I'm talking to you. Now, what did the United Nations conclude in 2016? World leaders, presidents, ambassadors, doctors, public health officials, education. So why aren't we listening to the United Nations consensus UNGAS Convention 2016? So let's take a look now, and let's start getting very scientific about vaping. Vaping has a media that carries the flavoring. That media is either vegetable glycerin or propylene glycol. Who knows what propylene glycol is? Louder. Antifreeze. Now you're saying, no, Dr. Fialkoff, you're making this up. Okay, you don't need it here, but in Puerto Rico, your kids vaping, some of them are vaping antifreeze, propylene glycol. That is one of the media that carries the flavorings. Remember what I told you, this is not my personal opinion. This is scientific. Now, the vegetable glycerin and the propylene glycol cause xerostomia. As dentists, we know if we get xerostomia, we're going to get caries and periodontal disease. We're going to get failure of our crowns from submarginal caries. I don't want to go over what you already know, so I want to be very quick with what we know as dentists and hit what's so important. How many of you, raise your hands, have kids? Okay. How many of you have nieces and nephews? Okay. How many of you have friends who have kids? I got you. Okay, good. All right. I'm not going to be serious, but I'm going to be very emotional. I'm a Cuban guy, and I really like America. When I lost my country, Cuba, I was very lucky that I had America. And Puerto Rico also, because we have America. Even though we got to figure out how we get them to make us a state, maybe, or I don't know, or independent state. But whatever, we're very lucky we have America, because it does stand for freedom. It's not perfect, but I don't know any family doesn't fight, so I don't know how we should expect the country to be any better. It'd be impossible. It's composed of families, and families fight over food even. I don't want to eat there. I want the Italian. No, I want to go to the Chinese place. What movie? No, that's action. I want drama, romance. So, okay. So that's the media. Now let's go to the next thing. Now we're going to talk about the flavoring. And a young person says to you, oh, come on, Dr. Smith, Dr. Goldberg. I'm just doing the flavoring. I mean, I know you're a doctor, but you're from a different generation. You look like you're about 60, 70. Come on, you got to come up to the present time. We're very smart in the new generation, very savvy technologically. But guess what? They don't know what they're talking about. The flavoring by itself, which is called diacetyl chemically, causes popcorn lung. Bronchiolitis obliterans is the scientific name. It obliterates your bronchial passages, which is why these young people end up in the ICU, and some of them die because they can't breathe. And the kids love to make different forms with a cloud, right? You see different, like Mickey Mouse and Donald Duck, and they're unbelievable what they make with those vapes. So imagine how much they're taking into their lungs, which is why they die. It's called popcorn lung because it obliterates their lungs like popcorn. Now, that's diacetyl. Now let's talk about what the heating element is made of. Now, heating element, again, it's going to be plastic or metal? Well, it's going to be metal because otherwise it's going to melt. Now, why am I saying that to you? Well, because there's been no regulation of the metal that's being used in vapes. So guess what toxic materials are in those vapes? Lead, that's really good for you. We eliminated from paint, so we got to put it somewhere. Like aluminum cans. We had too much aluminum, so after World War, so we made aluminum cans. It was really good for the health of aluminum. So now we have too much lead, so I guess we eliminate from paint, we'll put it in vapes. I'm going to try and make it facetious, humorous, and all at one time. And nickel, that's really good. Nickel. We were concerned about it with a guy in the laboratory with a partial dentures. So he's going to bring in nickel, but it's probably good for kids, though. It's okay. It's kids, so they're younger. So the nickel's no problem. Just the lab techs, because they work for us. And and then arsenic. But arsenic is good. The witches used to use it, and if you dig them up, they still look alive. Actually, I want you to know, if you use a little bit of arsenic, it actually doesn't kill you. It stimulates you. I don't want to tell people because I don't know what would happen. I'm afraid. And, next thing we know, we're going to have arsenic out in society because you do a little bit, and then some nut will mix it with fentanyl, and we'll have another crisis. But yes, a little bit of arsenic. By the way, a little drug stimulates you, a little bit more puts you to sleep, a little bit more, Keith Ledger, you're gone. That's the cycle of every drug. That's a cycle of sugar, too. Any of you who have a problem with sugar, it's because the body's addicted. So don't think there's something wrong with you or that I just like sugar, I can't stop. No, it's because you're addicted to the sugar. It's a drug. Anything the body gets addicted to goes the same cycle. A little bit stimulates you, a little chocolate, a little bit more, you go to sleep, a little bit more, you probably get sick to your stomach. You don't die. You have to eat too much chocolate. But that's the cycle of any drug. Now, why do I tell you this about the metal is this. There's another flavoring that's cotton candy. And here you see the name is called ethyl maltol. Guess what that is? That's a heavy metal transfer agent. Well, that's really good because now we have those heavy metals on the metal. So I guess the next thing we should do is put something that's going to transport it faster into the cells. I like the quiet. Yes, that's good. Okay, yeah, it's amazing. I know if we're in New York and I had a study club and this was about amalgam restoration materials, we'd be killing each other because as dentists, we really care. No, don't use that one, and that has too much mercury, and use this one, and that bonding agent is, I can't say the word, is no good. Use this bonding agent. I don't use that bonding agent. I use this, right? That's what we do. Dentists love that. We really care. But who's doing this about this? I guess we've got to get dentists to do this, and then we'll really care. So this is from Johns Hopkins University. Okay, let's go on. Remember that all I've told you so far is the liquid media, the flavoring, and the metal. I didn't even add anything yet. I already killed a lot of kids and didn't even add anything. I'm sorry if I sound like I'm a public health official, but I feel that as a doctor, I got to do something. You know, we lost Cuba, why? Because people didn't realize, right? We lost Venezuela, why? Because people didn't realize. So I'm going to ask you a question I want to answer. If people are getting drugged in every country, are they going to realize? No. If they don't realize, what can happen to their country? Louder? They're going to lose it. I don't think that guy out there who's really smart with the white hair, I don't think you'd like to be told what to do, right? I didn't think so. You don't look like that kind of guy. You could make it good in New York. And you might be, are you from New York?
No, but my son's in Sunset Park in Brooklyn.
Okay, there you go. All right. There you go. Now, I want to ask you a question because I like to do a lot of things in one shot. Do you have less energy now or more than when you walked in? Raise your hands if you think you have more now. Raise your hands if you think you have less. Good. Scientific study, because these are doctors who did the study. It was done with control study. My friend Christian did it. We have more energy. I'm not going to ask you like how you have more energy because there shouldn't be because you didn't eat anything. So I don't know. I don't think, just because in COVID we found out that the social distancing caused disease, we don't have to look at that either. I mean, social distancing was for disease. So, just being human beings, talking to each other, that's not important. We can just be on the phones all day long and not talk. I won't speak to Christian. It has no effect. But you see now that it does. This will be horrible when you walk out of here. You won't know what to do with yourself. Because you're going to say, boy, I got to be friendlier. I can't just be on my phone all day long. That's what my wife was complaining about when I didn't pay attention to her. I thought she was like being a pain in the rear. Okay. Now you see how we come alive? I want your interaction. Come on. This is for the world. Remember, we're being videotaped. This is for the world. They have to understand that they have to talk to each other. If they talk to each other, is it possible they may show up for your office on time? If they feel better? Probably they would, right? And if they had more energy, could they work more? Yeah. If they worked more, would they make more money? Yeah. Good. If they made more money, could they pay your bills? Yeah. Good. You have to not to worry about your billing agent saying, "Hi, Dr. Gonzalez, this nobody wants to pay." And for those politicians who are watching this video, you'd have more revenue. The economy would actually go up. But all we'd have to do is talk more to each other. We wouldn't have to legalize. I tell you what we would legalize. We'd legalize talking to each other. And we'd make it mandatory. Anyone who doesn't want to laugh, it's okay. In my world, you can laugh, not laugh. You're allowed to do whatever you want. Now, let's go on, because this is a dental lecture, and we can't talk about life. We have to only talk about teeth. So now here. Nicotine. Now we'll add on nicotine. Now, when you vape nicotine, because came out, e-cigarettes were a solution to cigarette smoking. But it hooks you more because it's heated. And you take it directly into your lung. So you have more nicotine. I mean, the studies haven't come out yet, so I guess we have to wait 10 years till 5 times the cancer rate happens. And so, oh yeah, vaping was really bad. We were right. But we'll wait till all these people die before we do something. Good, I got your attention. Okay, now, nicotine addicts people. But more importantly, who's vaping? Older people or young mostly? Young. What's developing in a young person? Their brain is developing. Here's the scientific part. When you take nicotine, there's a 13 to 25 years of age. Remember, this is not me. This is the CDC and NIH. I'm just making it interesting. Cuban people like to dance and I don't want to be like, yes, in the study of Maras and Morose in 1945, they showed that scientific base and 4,000 literatures. By the time we finish, everybody's dead. And I'm not being facetious because I love researchers. And I'm being serious because if they weren't around, we wouldn't have the solutions we have. Because I don't know how to do it. I'm being serious right now. So don't think that I'm picking on anybody. I just want us to wake up to how much we have. These lights are on because of people, aren't they? These seats are here because of people. This guy's here because he ate at some place this morning. So the people. Okay, let's go on. You already got the message on people. So nicotine. So we have a whole generation coming out. Their brain is irreversibly affected. It doesn't matter that when they get to 30, they stop doing it. They're irreversibly affected. So when you, what's your name? Yeah. Iada. When you become 70 and you have to go to the hospital, who's treating you? They are. Oh my God. Yeah, you didn't realize that. He did over there. He's like close to my age. I'm going to be 70. I'm going to be 70 in June, by the way. June 2nd, I get 70. So, it's, by the way, see, people say, wow, you look good for 70. Good. Do something about the community. Do something about drugs. You look like me. You don't have to look like me, though. You'll be better. You're handsomer. You have more genetics than I do. So you'll look better than me. I'm being serious. I'm also very honest, Next lifetime, I'm coming back a different, because I want to have more genetics behind me. I'm Jewish, guys, so what are you going to do? But it's okay. I get smart genes. Okay, good. So let's go on. What happened? I blew the thing. It doesn't want to work. We got censored. Oh, there we go. Okay. We had censored there for a second. All right. Now, you see how smart you all are? Because in order to laugh, you have to already know what I'm telling you. Otherwise, you think I was insane. But you're all laughing, so it means you already know it. So if you already know it, I'm only going to make you feel really horrible right now, because I don't want to patronize you. Why aren't you doing something about it? I'm going to be mean. I'm going to be like the professor in dental school and give you your test now. This is your test grade. You've got to go back and study, or you better start doing something differently in the clinic, because I don't like the amalgams you've been doing. But they're not amalgams, they're people, and they're all in your office. I'm being rough right now. I won't be nice, because I'm angry. I want somebody to listen. I don't want to wait till after war when all these people walk into wherever they walk into and say, oh my God, look at all these, oh my God, oh, they were so good when they were, at the graveside, right? I like to make humor out of it. So I want to ask you a question. Why didn't we do something while they were alive? Now, you see, I brought you down what happened to the energy level in the room. It went down. You got a little bit annoyed with me. You didn't like it, and the energy level went down. So now I'm going to show you something, because I like people to like me. Cuban people like that. So look at the person next to you and say, you know something? I'm going to do something to help my kids. Go ahead now. Look at the person next to you and say, I'm going to do something to help my kids. Good. Now make believe you're a dental professor. And look at the person next to you and like you're a dental professor in school. I'm going to do something about my kids. Go ahead. Okay, now look at me and say, Okay, Dr. Fialkov, I'm going to do something about my kids. Oh, that's like horrible. Come on, with some energy. Okay, Dr. Fialkov, I'm going to do something about my kids. Good, another scientific study. Where's the energy level now, lower or higher? Okay, another study on communication. Unbelievable. Wow. So if you want to be healthier, I guess we have to communicate more. And if you communicate to more community, that means you have more of their energy for free. You're actually getting their energy for free. And who wants to do better in their office and have more new patients? Give me a break. Come on, be honest. Nobody here with some suit on not answering. Who wants to have more patients in their practice? You don't? Let me have your office then. You're selling it cheap to me? You all do, right? Well, if you had a woman who was saving your kids at the school, wouldn't you elect her the mayor? Or the PTA president? Right. So who are they going to go to when they see that you're doing something about drugs in their high school? And you're a dentist, and what are you doing about drugs? Who are you? But you care and you teach them about drugs. Are they going to like you? Are they going to like him? Are they going to go to his office? There you go. So if you want to have more patients, do it for that reason. I don't care why you do it. And this goes for the video for the people watching it worldwide. I don't care why you do it. If you think you're going to make more money from it, who cares as long as the world gets better? I'm not interested in how it gets better. This is a different talk than you're used to. Remember, I was at the UN 6 times. I'm valedictorian. I have all these awards, but I believe in humanity. So let's take a look at what the New England Journal of Medicine says. If they vape, 43% are going to drink alcohol. I think if they come in your office, that's dangerous. Why? Because you've got to see if they're drunk. You maybe never realize it because you thought, well, that's a young person. This is New England Journal of Medicine. This is not Dr. Fialkov. They told you if they vape, 43% are going to drink. So when they come in your practice, maybe they're not getting anesthetized because they're high. They're drunk. Or maybe the veneer, the mother's complaining to you. You seem like a really nice lady. What's your name? Joanna. And the mother came in, Dr. Joanna, the veneer you made on my daughter is always red. The gum is always red. And we've been brushing the way you said. The daughter's like this, not saying anything, and you don't know what to do. Maybe she's been drinking. What happens when people drink? Haven't you seen how red they get, the gums, the periodontal structures? Yes, alcohol. 43%. Now, if they vape, 50% smoke marijuana. Okay, now we got to go quick because I want to get to a lot of things. Conclusions. Nicotine affects their brain irreversibly. You know that these flavorings and the media are going to be toxic to them. And yes, of course, they're more susceptible to the gram-negative bacteria, the pigmented bacteria, Ichinella corrodens, Fusobacterium nucleatum. I can throw all the names at you. What difference does it make? The important thing is that we do the therapy and we heal the patient. Make sense? All right, good. Let's go on. The American Lung Association President Harold Wimmer said, lack of the action by the FDA and federal government brought about a vaping crisis, resulting in skyrocketing vaping rates amongst youth. From 2018 to 2019, vaping increased 80%. Okay, so now let's go on, because you now 50% vape go on to marijuana. So let's talk about this. What does the ADA say? The ADA says that from their study, 52% of the dentists surveyed found their patients high on marijuana. That's the American Dental Association, 2022, not 2000, whatever, 15, 9. That's the American Dental Association. And they said that if dentists speak to their patients about drugs, that 67% of the patients like it. They want you to. They want us to tell them. You see that? You're safe. That's the ADA. Let's go on. Dr. Mascaridis, chair of the ADA Council on Scientific Affairs, says the oral health effects associated with smoking marijuana include periodontal complications, xerostomia, and leukoplakia. Leukoplakia, you know, a lot of times turns into cancer. Sometimes it doesn't, but it's not a good finding. We usually biopsy. You want to know, is it pemphigus vulgaris? You know, is it erosive? Is it going to affect their eyes? You know, all these things. CBD, medical marijuana, and marijuana do not carry the seal of approval for the American Dental Association for anything. Dr. Ken Finn, who's a physician in Colorado, basically said that since they legalized marijuana, opioids increased. And you say, but wait a second, because we've decreased prescribing. That's right, but this is a physician in Colorado, and he said because they legalized marijuana, not because you as a dentist were prescribing marijuana, because they legalized marijuana, opioids increased. Interesting. Let's go on. So, this is a scientific lecture. The endocannabinoid system is what we're talking about. CB1, CB2 receptors. CB1 basically reacts to THC, which is the element in marijuana that makes you high. CB2 receptors basically do with inflammation, edema, you know, and that's where the CBD works. And that's why some people think it works for immune system, inflammatory, Crohn's disease, these different pains and aches that older people get or anybody can get or athletes. Okay? So those are the two systems. CB1 basically is in the nervous system, the brain. CB2 is peripheral. Okay, good, quick, that's simple. THC and CBD are both in marijuana and hemp, but hemp, which mostly has CBD, and marijuana has mostly THC. When I was in high school, my friend smoked 1% THC. He got high on 1%, really good. And he was a football player, had a scholarship to play linebacker at Ohio State University. For the women here, if you don't know about football, Ohio State's a really important college for football. And if you go to Ohio State, you got a good chance of getting to the National Football League and making a lot of money. He was a great athlete. He smoked 1% THC. They kicked him out. He was so good. They said, go to Barrows Wallace Junior College. We'll take you back next year, full ride. It's only 1%. He should stop, right? No. He didn't stop. That was 1%. How many of you know how high marijuana is now? Anybody? 35. That's good. It's high. But that is a figure. What else? 15, 20. It's from 15 to 35%, depending on the strain that you get. Okay, so let's go on. Because I want to get for things on dentistry. So CBD, like I told you, is touted for pain relief, inflammation, anxiety, right? But what do you have here? I'll read it to you. There's little, remember, this is from the Mayo Clinic, not Ben Fialkov or Luis Guzman. Mayo Clinic, 2021, not 1942. There's little scientific evidence on CBD to substantiate the claims. There's concern of no consistent oversight on the reliability, purity, safety, and dosage of non-prescription CBD products. And I told you that the ADA does not give CBD seal of approval, but yet you see articles about using it for TMD, TMJ, oral soreness, blah, blah, blah. And you say, well, how can that be? Well, the same way you see on the internet about marijuana. You know? So let's continue. What does CBD do? CBD affects your liver enzymes. What pain reliever do you use every day that's metabolized in the liver? Tylenol, acetaminophen. What blood thinner is metabolized in the liver? There you have it right in front of you there. Warfarin. Motrin. Motrin's not really a blood thinner, but it's like aspirin. Okay. So they're metabolized in the liver. So what does that mean? When the CBD competes for those enzymes, the half-life of those drugs goes up. What does that mean? That now they're more potent, so maybe that person start bleeding. So you have some older person, like me, and I heard about CBD because you told me, hey, Ben, take some CBD. It's good for your back. And I don't realize that I'm on warfarin. I could have a bleeding problem. Maybe I'm playing racquetball because I'm like this older guy who's motivated, And I hit the other guy and I hurt my hand. I started bleeding. I don't know why. Well, I was on CBD. It affected my liver enzymes and the warfarin went up. I had too much warfarin in my body, blood thinner. Now, you look like this young guy with a telephone. There you are, right there. You look like you probably like to do implants.
I would like to, yeah.
Right. See, the guy next to you is your brother?
Almost.
Okay, good. You would do implants.
No, not yet, but I would love to.
Okay, hold on. Who does implants? You do implants. I knew it. Where do you practice? ¿Dónde tú practicas? No, tú.
Ponce.
Ponce. You do implants, right? Yeah. Good. So he does implants. But somehow, he probably knows it, but let's make a guy like him. Doesn't know about CBD in Puerto Rico. And his patient starts bleeding. And you look like a really nice guy. It would really bother you. And you'd be like home, and you'd be really bothered. ¿Por qué yo hice eso? And you're researching everything. Now you know. They were taking CBD, so they bled. Or you gave them acetaminophen, and we have to worry to give too much acetaminophen, right? You know that. You can't give too much. I'm talking about normally, because they can have a problem with the liver. But now, you don't even give them too much. And they get the CBD, and they have a problem with the liver. And they look at you, this nice lady here, and they complain to you. Doctora, you speak Spanish? Doctora, me diste mucho Tylenol. Mi esposo me dijo. I told her in Spanish, I said, Doctora, you gave me too much Tylenol. My husband said it. He told me not to go to you. It was the CBD. It wasn't you. So it affects liver enzymes. Where do you see that on the internet? Why isn't it everywhere? What are they going to be waiting for? Right? So it looks like the CBD affected the camera too. Unbelievable. It has, so it's affecting liver enzymes. So let's continue. Look. Now, this is very interesting. You're going to love this. CBD and THC chemically have very similar bond strengths. I love organic chemistry. It only has one of the rings is different. And if you close the ring, guess what happens to CBD? It becomes THC. Have you ever had anybody say, but no, I flunked the test, but I didn't take any marijuana? They were probably telling the truth. They probably just had CBD only. And they took a test. It was a governmental test for a job. And it came out that they were taking THC. You know why? Because CBD in an acidic environment, you can read it, Scientific Reports 2021, that's a reference, turns into THC. Interesting, right? Let's go fast. So in acidic conditions, the CBD turns into THC. And then there's going to be debate, but there's debate about marijuana, even though I'm going through all the science. So don't you think there's going to be debate whether the CBD in the stomach transforms to THC? Of course, it's going to be It's going to be inactivated. Of course it is, especially if you're selling the CBD. Did you follow me on that? Okay, good. I want to make sure I don't go too fast. Because you have to know who's doing the research. Because this guy knows, he smiled, he lit up. He knows there's certain things that he bought in his practice, and they had good research, and he knows that it was not real because they were bought. Is it true? I saw your face light up. I could see. We're doctors. And I want to plead with you. You're doctors. You guys are different. You actually are insane. You care about people. I mean, you actually care. People yell at you. They don't pay you. They steal. They took your bridge, left, and never paid the last payment. Unless you work in Mars, you have to go through what I went through. Look how good you are. You're still here. And you're here at this lecture. Unbelievable. And I'm beating on you. You're staying here. You actually care. I want you to see. I want to do something for you. Is it okay if I do something for you? But you got to answer me. You see, my wife, if she tells me things 3 times and I don't do it, I'm going to ask this lady. Because you look tough. You're good looking like my wife. If your boyfriend doesn't answer you after 4 times, do you finally excise him and get another guy? You're too easy. This one. When you were 18, if the guy who was with really handsome, but he was a jerk, didn't you get rid of him? What? Okay, wait, hold on.
But if you ask me more,
Now?
Definitely.
Get rid of them, right?
Get rid of them.
Okay, good. And here, look. Esta, here, this one. You've been smiling along. If some really good-looking guy, he looks like a stone, but he's a jerk. 4 times you told him not to come late, and he still does it. Would you stay with him? No. Say louder?
No,
No. Why not?
because he's late.
Okay. Can you trust him?
I don't.
Good. Okay, good. All right, good. So what's that got to do with anything? It has everything to do with it. So I want to do something for you now. You ready? I said I would do something for you. Do you agree that you care about people? Raise your hands. Okay, so, and even the guy back there who didn't want to raise his hand, if you care about people, look how you play racquetball. If you care about people, doesn't it bother you if it doesn't come out well? It's you. I know you see me. Doesn't it bother you if you care about people that it's not being done the way you think it should be? Yes. So if it bothers you, doesn't it bother you at night? Yes. And if it bothers you at night, is it possible that you had difficulty sleeping? Yes. Is it possible that if it continues to happen, you would get high blood pressure? Is it possible you start getting angry? Yes. I'm doing something for you. I like you guys. You're a dentist like me. So what does that mean? You have to follow your basic purpose. Not mine, not your professors, your heart. And if you do that, you'll have more energy and you'll be healthier. That's the difference between Michael Jordan and some other guy who had the talent and didn't make it. Why? Because Michael Jordan had the purpose. You guys are here, you have the purpose. Let me continue. I'm talking too long. Faster. You need more information. You already knew all this. Okay, good. So, faster. So what does the FDA say? Not Dr. Christian. The FDA says, how much CBD is safe? How does it vary on what form it's taking? What are the drug interactions? What are the impacts? So we don't know. Now, this is the FDA. Fast. You guys like it fast, like in New York. The FDA only approved for epilepsy and cancer. There is nothing else approved. Next. I want to see if I can play these. Do I have internet here? Yeah, can you look at these I know you're a genius. Look up these things and see if you find it on the internet. You have them so I can continue? Okay, good. And then let me see it before you play it. Okay, here we go. Now, fast. Medical marijuana. 90%, oh wait, hold on. Let me go to the important one. Here we go. 90% of medical marijuana has levels of THC of 15%. How much did I tell you was in regular marijuana? At the bottom, 15 to 35. Medical marijuana is supposed to be for people for pain relief, but not to get them high. But 90% have 15% THC. And those people who are taking medical marijuana have a problem, chronic problem, right? Pain, disease, whatever. So they want to take it for that, right? So what's going to happen to them? They're going to get addicted. They're going to get addicted. This is problematic because 68% of patients who use medical marijuana use it for pain relief. Okay, now, this is from Pharmacology, 2018. Scientific review of marijuana results. Long-term studies are not encouraging on pain relief. Literature data shows that oral marijuana have inadequate efficacy on pain relief. Oral marijuana does not reduce acute or postoperative or chronic pain relief. I'm omitting the things because pain is pain. Doesn't matter if your head hurts, your foot hurts. What does it matter what's hurting? It didn't work. So what are we using it for? To get people high? If it doesn't give pain relief, then, but I feel bad for people who have cancer. I'm not an ogre. I don't want somebody to suffer. And probably if somebody was dying, you know what? I would give them the vape and I would give them fentanyl even. Because, no, you know why? Because they're going to die. And I don't want to hurt them. And if they're going to die, at least don't let them suffer, right? I'm being serious to you. Don't think that you got some kind of wild person up here. I'm a human being. If the person's going to die, and they know they're going to die, and the whole family knows it. Let's at least make them, if we can't do anything, let's at least make them comfortable. I'm being serious. That's what we need in our society. We got to be real here. Make believe it's you who's there. Nobody. You know what? This is another thing I want to give you. You ready? How many of you want to sell more cases? You guys are tough. Are you from New York or from Puerto Rico? How many of you want to sell more cases? Nobody? Okay, then I won't give it to you. That's it. I'm not going to give it to you. I was going to give it to you. I'm serious. I was going to give it to you. I'm going to give it to you for a different reason. When you look at me, here, look at me for a second. Everybody. When you look at me, don't you make an assumption about me? You guys are tough. You must be Russian. My friends are Russian in New York. So you make an assumption, right? You know something about me, right? Yes, you do. So if you know something about me, that means that the patients, when they look at you, know about you. You don't need any technique from anybody. I always pick women because women have men chasing them. So let me see what woman I haven't picked on that will. She'll answer me. If a man is chasing after you, don't you know which one is good and which one's bad, even though they're both good looking? Probably. Thank you. She's going to answer me true, right? Louder. Yes, right? And the ones that you know you don't trust, you get rid of them, right? You don't pay attention, right? Or you go like this. And you get rid of them. I'm part woman. My wife taught me to be part woman. I think women are very smart. So, okay, let's go on now, fast. We know about this. Oh, this is very important. In Colorado, more than half of the high school students who use marijuana reported they use a dab device to do it. Why is that important? A dab rig, which looks like a hookah, right, or a bong, causes 80-90% THC level. So let me read this to you again now that you understand what that dab is. More than half of them reported using a dab rig. That means they were doing 80-90% THC. And 32% of those were driving right after they did that. That's a good thing. So they drove a car on 80-90% THC. Okay, now, I want to give you something because I like to teach. ¿Qué hora es? ¿Qué hora es? 15 minutos, right. So we have 15 minutes, but I could feel that your attention is wavering. I could feel that as a speaker. Your attention is wavering. So I want to ask you now, because if I assume, there's a thing about assuming. He knows what it means. I love it. You know, assume. You don't want to make... right, exactly. Good. And even the people on the television got it now. We don't want to assume. So, is there anything you want to know that I haven't covered so far? Because I'm in the middle. I'm going to get to marijuana.
What can we do about it?
Okay, good. I'm going to tell you in a second. Okay, let's continue. Now, the FDA legalized the CBD that has a 0.3% THC. 0.3. It's almost nothing. And they've only done it for cancer and epilepsy. So what am I trying to tell you? Forget about these other things. The other day somebody sold me something and there was a CBD cream. What do you know I'm going to do with it? I'm going to just put it on the side. I'll probably study it or something. We'll see. I'm not going to use it. Some of you guys probably got it here too. It's not a good idea. A lot of people are going to come after me, but I'm not here for money. I'm here for health. I'm not here for money. And we'll make more money as a profession if we really care about people, because I just told you that if you look at me, you can tell what I'm thinking, right? And you're a guy. So if we were at the gym together, we'd probably hang out, right? Isn't it true? Why? Why?
Because we have things in common.
Louder.
Because we have things in common.
Louder. Yeah.
Because we have things in common.
Exactly. So realize people are people. And if it was you, would you like to be treated like a jerk? No. Who wants to be treated like a jerk? Nobody. Okay, now, next thing. Let me go back. Marijuana is a Schedule I drug. Has no purpose whatsoever by the FDA, DEA, CPP, RBD. But guess what the politicians want to do and what they want to do and Biden wants to do. I'm not a Democrat, Republican. I'm an American from Cuba, and I want to preserve America. I want a new party, the American, Cuban, Puerto Rican, Jewish, Chinese party. So we preserve America. And we make the melting pot continue to melt in a good way, go higher. And everybody else can stay in their places if they want to ruin it. So it's a Schedule I drug. It has no use. So guess what they want to do? And yes, I'm getting on the media. You may get upset with me in politics, but it's not okay. Sometimes the professor yelled at me, and I had to get my act together. I'm not here to win favors. So they want to take away the labeling on it. So it's not scheduled anymore. To look it up on the internet, you'll see. That's really good. That's good. They're going to make us not prescribe opioids, but they're going to take the label off of marijuana. Why don't we just take the label off of opioids too? No, that we won't do. That's not part of the game. Okay, now, so CDC, marijuana has been shown to increase the rate of opioid misuse. So doesn't that mean it's a gateway drug? Louder? Yes. And who said it? Come on, let's do something. I want us to learn something that I learned, and I'm thick-headed. I'm a pain in the ass. I think I know a lot of things, but I learned something. I didn't know a lot of things that I thought I knew. And somebody taught me the best way to teach is this. They call it Chinese school, or military. I say something, and you send it back to me loud. Ready? So, tell me, marijuana has been shown to increase the risk of opioid misuse. You tell me loud. What happened? All the way through. Read the whole line. Good. And who said it? Okay. Do you have any doubt now? So you know it's a gateway drug by who? CDC. The organization in charge of drugs in the United States of America. I think that's pretty important. I have a meeting March 22nd at the United Nations, and the head of research, Susan Weiss, of the NIH is going to speak at that event, and dentistry is going to be there. I want to tell you, not Dr. Fialkov, dentistry is going to be there. Clap for dentistry, not for me. We don't need any more generals. We need human beings. And we need to help each other. And the world needs the dental profession now. And if you're Jewish or Catholic, white or brown Dominican or black or green, Buddhist or Hindu, does it make any difference as long as we educate them on scientific truth of drugs and the kid doesn't go on drugs? That's a question. The answer is? Don't get so quiet. The world's waiting on you. Right, makes sense, right? Okay, good. Let's continue. I get a little pumped up. Marijuana causes social anxiety, depression, suicide. By who? CDC. So now you know why Colorado has a mental health. Good. Next time some guy on the internet says there's a mental health problem in our thing, we need to legalize psychedelics and have more drugs, you're going to say, the CDC said marijuana is linked to anxiety, depression, suicide. Okay, next. Anesthesia. We're dentists. Increased anesthesia requirements for marijuana users. That means if any of you oral surgeons, and you probably already know this as an oral surgeon, you're not going to have a very good time with your anesthesia. And they have higher pain scores. If you've been wondering why somebody came into your practice and yelled at you, it's because they were using marijuana. It's not because you're a bad doctor. Oh, mi madre, mi inyección. ¿Qué pasó, doctora? Tú estás brava hoy. In English, it said, oh my God, that injection was horrible. Doc, did you have a tough time with your wife today? No, they're on marijuana. They're going to have higher pain scores. They're not going to be normal like you. There's the faces they're going to give you. I'm going to save your lives in the dental office. I wanted to do the whole Congress. I want to do the ADA. I need us to wake up before nobody shows up to work. And you'll be all alone doing your implant. Because your assistant will be high. When are we going to wake up? Here. I got to calm down. I'm getting too excited. Now, dental considerations. You get xerostomia, periodontal disease, caries. I did an implant on a beautiful Colombian woman. She was about 32. She's beautiful. It failed. I'm a good surgeon. My implants don't fail. It failed in 3 weeks. Fell out. I said, don't worry. I thought nothing. And I just did the bone graft on a membrane. I said, it's okay. It's going to be fine. 3 weeks later, the membrane got exposed, and that didn't work. So she came back, and I said, you know, I don't know what's going on, but I'm afraid to do anything anymore. Do you smoke anything? No, I don't smoke cigarettes. But do you smoke anything? She goes, yeah, I do marijuana. I go, oh, marijuana causes poor healing. She said to me,